This time of year, many people are working on all kinds of New Year's resolutions, getting organized, planning for the future, advanced directive documents, and making your healthcare preferences known. Well, that's something that should be on the list as well. Dr. Elizabeth Golding, Medical Director of Cone Health Palliative Care Services, is guiding us on that topic today. All right, so let's just start from the beginning. When should we all start thinking about advanced care planning so we can start that with our families and with our own kind of mindset?
Yeah, sure, Tanya. Thanks for having me today to talk about this important topic. Advanced care planning is really an activity for any adult. So you can actually begin advanced care planning at the age of 18 when you're able to make your own medical decisions. And we really encourage advanced care planning to start that early. Unexpected accidents can happen at any age. And it's important to think about things like who you might want to speak for you if you are unable to speak for yourself. Too oftentimes people don't have these things in place, and when they're facing unexpected medical crises, they have to make decisions under pressure. And so we really encourage people to think about this ahead of time.
Yeah, because you are the only person who knows what you would choose to do.
Absolutely, and it really is a way of it's a point of empowerment for people. And we plan for all kinds of things throughout our lifespan. We plan for the birth of children, we plan for college, we plan for retirement. The one thing we often fail to do is plan for what might be the end of our life. It's also the point in our life at which we may be most vulnerable. And it's not just for the sick or the very elderly, but it's also for anyone who's young if they're, face an unexpected or trauma or crisis that couldn't, be anticipated.
Sure. Okay, so let's kind of go down the list of what forms are you referring to that everyone should have and complete?
Yeah, so what we're talking about today really is advanced care planning in terms of a living will and healthcare power of attorney. A living will document in the state of North Carolina allows people to express their wishes should they become severely incapacitated, so unable to really think or speak for themselves. The most important part of the documentation, in my opinion, is to identify also a healthcare power of attorney. So this is someone who, a trusted individual, it doesn't have to be even a spouse, it's whoever you think would be the best person to make decisions for you if you were unable to do that for yourself. Outside of the documents, the most important thing is really the conversation that you have with that person. It's not necessarily like a one and done thing. Sometimes people worry once they put this in writing, it can never change. These are dynamic documents. They can change over time, and you can also change, you can even change the people you choose to serve in that role for you, and they should be updated at regular intervals. But anyone can be named your healthcare power of attorney that you trust and feel that would act on your behalf in the event you were unable to speak for yourself. Sometimes people worry that if they do these documents that they lose their voice. That is not how these documents are designed to be. You maintain your voice as long as you have it and are able to communicate and have capacity to make your own decisions. You will always be in control of your own choices. However, these documents are important if you ever get to a place where you're unable to do that.
Yeah, I mean, what happens if you got into a car accident and you were unable, you were out, right? And someone needs to make the choice, are we
Right.
going to have surgery? Are we not going to have surgery? That kind of thing. Okay, so when you
Exactly.
talk about these documents, they seem, like you said, that they can be changed pretty frequently if we want to be able to do that. How do we get our hands on those documents? What's the process?
So we make it pretty simple for patients at Cone Health. You can access those documents through our advanced care planning website, which is conehealth.com/advanced care. And if you will go to that site, you can actually download the documents. You can also access those documents through MyChart app. And if you're uncomfortable with those types of platforms for downloading documents, I encourage everyone to discuss it with your primary care provider. Our primary care provider practices are equipped to help guide patients through that process and also help with any decision making or legal things that are needed to complete those documents.
All right, and that website that she talked about, that Cone Health website, we're going to be putting that link into the story, and we're going to be posting this interview on our website later on this afternoon, so you'll be able to have that. Why are forms so important versus just saying, I want you to do this for me if something should happen?
So the forms really are important because a lot of times patients and families will say, well, my family knows what I want. They know what I want. But under the pressure of a medical crisis, people have a hard time speaking that or articulating that. And so the documents really give not only families a sense of security, but it really is a gift you give to your families to go ahead and have it in writing, so that there are no questions. And also for the medical team, we at Cohen Health take these documents very seriously. We store them in an easily accessible electronic form within the electronic medical record. So you don't have to keep them in your safe deposit box or somewhere hidden away. We will have them easily accessible for you if you have those forms completed. We really strive to make sure that we do that in this system so that not only are we talking to the right people in the event of a medical crisis, but that we have your wishes documented and can refer to those if needed.
Yeah, you answered the question I was about to ask, like, what do we do with those forms once we have them? Having them already on the website and things of that nature for you to be able to access makes it so much easier. Okay, we're going to continue talking about this end of life care and how do we deal with this process and what kinds of things do we need to have in place. We'll be back in just a few minutes.